Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.
Welcome to St. Louis on the Air. I'm Sarah Fenske. If you're living in the United States, you surely know someone who's faced a ridiculously large medical bill. In fact, 1 in 5 Americans now has medical debt in collections. Half of patients with medical conditions like stage 4 breast cancer report being harassed by collection agencies even as they undergo treatment. So yes, we're all familiar with the horror stories, but many of us have little understanding what's at the root of these outsized bills. Dr. Marty Makary is a surgeon at Johns Hopkins University who wasn't content to shrug off the horror stories as just the way things are. His new book, The Price We Pay: What Broke American Healthcare and How to Fix It, goes deep on the crisis in rising healthcare prices, and then it explains what we can do to solve the problem. Dr. Makary will be at the St. Louis County Library headquarters tonight at 7 p.m. to discuss his book. But first, he's joining me in studio to talk about it. Dr. Makary, welcome to the show.
Great to be with you, Sarah.
So when I referenced rising healthcare prices, I did that very intentionally. You make a point in your book of saying we should talk about just that and not healthcare costs. So why is that?
Well, it turns out that the words we use really shape the debate. And if we call things by the real words, that is, if we call them medical prices and not healthcare costs, it has more meaning. And it really gets at the real issue, and that is the prices are way too high. Look, if we talked about gas in terms of the petroleum futures have increased versus gas prices went up, it has a different meaning. So I try hard to use the right terms. And right now we've got money games, price gouging in the marketplace, if we can call it what it is, and even predatory billing. So I think it's good for us to reshape the conversation.
Seems like a good start to talk about the thing that actually affects the consumer, and that's the price.
Yeah, I think about in the health policy world, we talk about bills that are not collected as bad debt. That's how it's referred to legally. That's how it's taken to court by some hospitals. I call them unaffordable bills. People they just don't have the money. They're not bad people.
That's a much more compassionate way to look at it. Mm-hmm. Now, big picture, you go into this very deeply in your book, but what do you blame for these prices being so out of whack?
Well, first of all, Sarah, this whole cable news echo chamber debate that we're a divided country, okay, forget about that. Throw it away. That is such nonsense, and it's divided. It's created to polarize us, and it actually serves the interests of a lot of ratings groups and TV and media and politicians. We are a united country. We are all united against corruption, the mass disproportionate interest of special interests and their ability to drive things, a pothole in a community. Look, we need to talk about what we have in common and appeal to the best in people and remember our great medical heritage and our tradition of taking care of each other. So we really break down healthcare, just like the movie The Big Short did for the banking industry, and we can explain it, I think there's broad consensus. The real issues driving up the cost of healthcare are pricing failures, middlemen, and inappropriate care. And I try to go through each of those examples and give the disruptors that are shaking things up now, because there's a movement to reclaim healthcare.
So let's talk about the middlemen for a minute. This is one of the parts of the book that I found most interesting. You really come down hard on this game that is played by insurance companies and hospitals. For those of us who aren't in the middle of this game, tell us how this works.
Well, first of all, Sarah, I have to tell you, I know the people who are leaders of hospitals here in Missouri, around the country. They're good people. Insurance executives, they're good people. We have good people that go into healthcare, but they're working in a bad system. And we've inherited this crazy game where we inflate prices to be able to offer selective secret discounts to different insurance companies and employers, and that game enables price gouging. If airlines did not have to show you a price on travel sites and they simply billed you after the flight, guess what? They'd be gouging left and right.
We would be in big trouble.
We'd be in big trouble. And it's that lack of a transparent marketplace that enables gouging. And in healthcare, we don't have people diabolical trying to hide prices. We've just never at hospitals had to produce prices. We've never had to itemize services before. Hospital leaders are busy taking care of their hospitals and meeting the regulatory requirements. But this is a structural issue that is now getting disrupted by this new price transparency movement.
So you compared the haggling that hospitals do to the open air bazaars, like the ones in Egypt, which I know your family.
My home country.
Yeah. So you're allowed to make that comparison. Tell us a little. What do you mean by that metaphor? What's the back and forth here?
Well, my family is from Egypt, and I remember going to visit as a kid, and there's the largest open air bazaar in the world at the time called Kana Khalili. And this place is a place where it was a tourist trap. You'd go in there and see a little alabaster pyramid, and the merchant would catch your eye looking at it and set the price at $100, even though the real market value is about 50 cents. Mm-hmm. And then the haggling begins, and you feel that you won because you got it for $40. Well, those crazy games are going on in healthcare today, and it's a disgrace. It is now threatening the great public trust in the medical profession to set these egregious prices, and then somebody comes down and they can knock it down by 70%. Oh, so you can come down that far?
And then you explained that some people don't even get to do this haggling. For example, you pointed out the Amish or people who don't have insurance. They're getting stuck paying full freight. Is that the source of some of these really eye-popping bills that we hear about?
Yeah, when my research team started to do work on what we call the markup, that is the amount above the Medicare allowable amount, hospital leaders would tell me, my friends would tell me, Marty, you have to understand, nobody pays those sticker prices. Oh, well, let me introduce you to the Amish community who believe as a part of their faith of paying bills in full and having no debt. Let me introduce you to the uninsured who may not know to ask for a hardship exemption. Let me introduce you to the poor person coming in with an out-of-network inflated bill at an in-network hospital, a bait and switch that we should be ashamed of. And these many games are resulting in a lot of casualties.
So there's completely different bills for different people coming through these doorways.
A research study that I believe was the study of the year was done by a University of Iowa professor that called 100 hospitals that do open heart surgery. 50 could give him a price. After he haggled and called back and talked to different people, only 50 of the 100 hospitals could give him a price. Of the 50 that could, for this very standardized procedure, the price ranged from $44,000 to $500,000 with everything in between.
For the same procedure?
For the identical procedure. That's a very standardized procedure. By the way, in India, it's $500 US. And he then took those prices of the half of the hospitals that gave him a price and compared them to the quality, that is the outcomes measured by the Independent Society of Thoracic Surgeons, the most mature quality registry we have in healthcare, and there was no correlation.
So the higher price didn't mean you were getting a better surgery?
As a matter of fact, not at all. There were great hospitals with some of the lowest prices, and I bet you'd see that here also in Missouri. My team then looked at those prices and compared them to the charity care offered and found no correlation.
That's interesting because we do keep getting the answer that paying customers have to absorb the fact that hospitals do charity care.
All hospitals do charity care. I mean, we've been doing that since most hospitals were built by churches. And, this idea that hospitals are operating on a razor-thin margin and taking care of all these uncompensated, services.
I mean, it sounds good. You're saying that's not true?
Well, it's just true universally. It's true everywhere, with some exceptions. We do have hospitals in wealthy areas with very little uncompensated care, and they should disproportionately be, they should have lower prices. Look, I found a skier who went to Vail Ski Resort, hurt himself, went to the local hospital, was charged $10,000 for a little altitude sickness evaluation that took 45 minutes. Does the hospital at Vail Ski Resort take care of so many uninsured and homeless and immigrant skiers?
Yeah, they're just drowning in charity cases in Vail, right?
Right. It's gouging is what it is, and we need to call it out because it's threatening the great public trust in our great profession of medicine.
Now, NPR has been focused on healthcare prices with its Bill of the Month series, and about a month ago, NPR's Bill of the Month featured a patient named Wolfgang Bolzer and his family. They wound up with a hospital bill for his hernia surgery that was wildly higher than expected. Let's listen to a little bit of an audio feature by WNBR's Nicole Leonard as she visits the Bolzers' home, and Wolfgang and his wife Farron describe the series of events.
Wolfgang Baltzer is lifting his 18-month-old son into the air. His wife, Farron, says just a few months ago, before Wolfgang's hernia surgery, she would have been worried about him.
I would not be happy with him doing that because I'd have been going, babe, you're gonna hurt your hernia even worse.
After a successful surgery, Wolfgang is back to lifting a toddler, chasing a 4-year-old, and playing host to a house full of family visiting from Germany.
We're having mac and cheese today.
Nudeln haben! My daughter's favorite, and it's a nice, quick, instant pot meal.
Wolfgang knew for years that he'd need the surgery one day, but it wasn't an emergency. And the Baltzers are planners, so they waited for the perfect time. They planned it for the same year their second child was born so that they would meet their high deductible. But Wolfgang grew up in Germany, so he wasn't used to this tactical way of making healthcare decisions.
To have to think about when and for what you go to the hospital, that's a foreign concept to me.
Before the surgery, they called the hospital, their insurer, and the surgeon to get cost estimates for the procedure. They figured out it would be about $1,400. Not cheap, but doable. The surgery went smoothly, no complications, and the hard part was over. Or so they thought.
When the bill came in, we opened it. I knew it immediately from the numbers that this is off. And I showed it to Farron.
And I think I went, oh, hell no. We are not paying this.
Their bill was 50% higher than the quotes they got. Wolfgang picked up the phone to try and get some answers.
But how many times in total do you think you called Hartford Hospital?
I don't know, but I know that the more I called, the less hopeful I got because I knew that I didn't get anywhere with them.
Right.
And it just said a quote is a quote. You know, I'm sorry that you had a bad estimate.
The hospital's position was that the estimates were a guess. Those amounts were never a guarantee. That left the Baltzers feeling like billing estimates don't mean anything. So why try to plan? Why bother?
We plan things to death. And when plans don't go according to plan, it becomes very frustrating.
Wolfgang is resigned that this is how healthcare works in America. And this is what his young family growing up in Connecticut will be up against.
Do you pick this fight every time? Trying to understand what you will owe and keep doing that. But it adds stress to something that should just be straightforward.
It may not have been straightforward, but it was perfectly legal. Unlike other industries, hospital estimates are under no legal obligation to be accurate.
And that was WNBR's Nicole Leonard reporting about a month ago for NPR's Bill of the Month series and talking to Wolfgang Baltzer and his family about their bill for hernia surgery. So it's completely legal. They don't have to, you mentioned earlier airlines, if they gave us a price and later changed it, they would be in big trouble with the consumer law. So how did we get to this point where hospitals can just do this?
Well, it's a disgrace. And, as a doctor, I love being a doctor. We should be ashamed of this stuff happening. I actually go to court defending patients around the country, telling hospitals, look, if you don't give them a price, you have no right to go after them and ruin their credit history. You have no right to put a lien on their home and garnish their paychecks, as we've seen around the country. I will go to court and I tell these judges, Your Honor, I can't mow your lawn and send you a bill for $4,000 without an agreement. We need civility in healthcare. And hospitals are doing it now. We've got online platforms that are doing it. But this idea of taking advantage of people at a time when they're vulnerable, it's sick, and it's a disgrace to the medical profession, and it's violating the public trust in hospitals. 64% of Americans in one study say that they've avoided or delayed medical care for fear of the bill. And,
that's a problem.
That's a problem. Billing quality is medical quality. Financial toxicity is a medical complication. And when we take care of patients as a doctor, we take care of the whole person. And this stuff is a disgrace. The patient did not come to our billing department for care, for treatment. They came to us, the physicians. And that's why we doctors are rising up now to say this is completely out of control.
We need to take a quick break, but we'll be back shortly to talk about just that. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
Welcome back. We're here in studio with Dr. Marty Makary. He's a surgeon at Johns Hopkins University and also the author of the new book, The Price We Pay: What Broke American Healthcare and How to Fix It. He'll be at St. Louis County Library headquarters tonight at 7 p.m. Doors open at 6 p.m. and books will be available for purchase. Dr. Makary, you dedicate this book to your father and, quote, whose compassion in caring for cancer patients has taught you that part of being a doctor is the responsibility to advocate for those who are the most vulnerable. During your travels and research in 22 different U.S. cities over the past couple of years, do you find that most doctors' hearts are still in the right place despite this terrible status quo we've been discussing?
I do, and one of the reasons I'm so optimistic is look at our young students and doctors and the young nurses. I mean, people go into healthcare for great reasons. We're all united because we went into this out of a sense of compassion. But I think I even believe that for our hospital leaders and insurance executives. But the problem is sometimes we all become disconnected. And I realized that on these travels when I met Steph, a waitress in New Mexico, who had told me that she had been sued and had her wages garnished. Now, Steph, I went to her home. I had a journalism mentor who, as a journalism professor, and he told me, look, Marty, for this book, I want you to get on the ground.
Talk to people.
Talk to people. And it's amazing when you get proximate how you see the world differently. And Steph is the single mom of 3 kids. She's about in her late 20s. She took a second waitressing job because the hospital sued her to garnish her paycheck at the first waitressing job, and she just can't put food on the table. She doesn't qualify for Medicaid. And it hit me as I was in Steph's home, most of America does not live like me. Okay, God's been good to me. I've had a great life as a surgeon. I love my job. Half of America has less than $400 of cash in their savings account. Those are the stats. See how they live. See what a bill of $2,000 means to them versus to those of us that are so-called healthcare experts. And so we've got to remember the people that we're serving.
And you're out there in this book. I mean, part of what I loved about it is you do have those conversations so many times. And in other parts, you're the gadfly who's trying to help these people get things fixed. But yet there's so many times in these stories that you tell that I came away from this going, wow, there are doctors that are out there that are just using bodies as ways of making money. For example, the situation in Carlsbad. I mean, you went to this particular town in New Mexico. You mentioned that Steph was one of the people you visited there. But overall, what you found in Carlsbad was horrifying. Tell our listeners a little bit about just the overall population in this town and their interactions with this hospital chain.
Well, Carlsbad is sort of classic Americana. It's a town of about 28,000 people that swells up when the oil workers move in and the miners come in. And I found out about it because a woman reached out to me who felt wronged by the system. She was she's the mom of 4 kids. 2 have special needs. One of them got sick. She took the kid to the hospital. Turns out it was a big nothing. The kid was fine, but in the process of evaluating her, they put an IV in the kid, and that IV got infected, what we call in the safety world a hospital-acquired infection. And the kid went to the ICU and was in there for a long time. Well, there was a massive bill. Now, this is our fault, okay?
Right, the kid would have never had this problem if not for the IV.
Right. Where's the humility? They slap her with this giant bill, then they sue her in court. And I went to her house and, again, reminded that most Americans don't live like me. This is sort of everything wrong with the healthcare system right now.
Well, and it wasn't just this woman. I mean, part of what was so shocking about this chapter in the book is literally everyone you met in Carlsbad was being sued by this hospital, and they're garnishing people, taking away their minimum wage salary. They even sued the judge for a hospital bill.
They sued the judge, yeah, they could by accident.
Yeah, and so it turns out this hospital is run by Community Health Systems, which operates 3 hospitals here in Missouri: the Moberly Regional Medical Center, the Northeast Regional Medical Center in Kirksville, the Poplar Bluff Regional Medical Center in Poplar Bluff. You wrote that you found some similar lawsuits in Missouri. Do you get the sense that the situation here is just as bad as it was in New Mexico, or?
I think so. I mean, I called the Washington Post and told them about the hospital, one of the hospitals here that they profiled, owned by Community Health Systems. Look, Community Health Systems is based in Franklin, Tennessee. If you've ever been to Franklin, Tennessee, It's one of the most beautiful and wealthy towns in America. It's gorgeous. And there's a massive disconnect between what's going on the ground. And I've asked them many times to please stop suing patients. Remember why we went into medicine. Remember the great public trust in America's hospitals. And we've had no luck. We've got them to slightly revise their policy in Carlsbad. And I was really disappointed because many hospitals are responding to our request. The hospital in Virginia that had sued 25,000 people in a town of around 30,000 has agreed to stop all lawsuits against patients.
So you've really made a difference here in some of these communities, but it seems like in other communities, like, for example, this one running the hospitals in Missouri and in Carlsbad, they seem almost immune from shame.
We need public accountability. When these hospitals were built, they were built in their communities, by their communities. Many of them were built by churches. And now, Wall Street folks have bought them up, and central corporations have created this practice of corporate medicine where you cannot even talk to somebody if there's a mistake on your bill. Shame on them. This is our profession. I'm very proud to be a doctor. American hospitals are trusted institutions, and now these money games are threatening the great public trust.
I thought one of the more interesting parts of your chapter in Carlsbad is where you ended up talking to a surgeon who was employed by this hospital, and it legitimately seemed like he had no idea that his hospital was up to this practice of doing this to the very people he'd operated on. Do you think doctors have kind of looked away because they just don't want to deal with the messy underside of how they're making their money?
When I went to Carlsbad, every person in that town, from our driver to the hotel clerk to the waitress, would tell me that it's well known the hospital sues everybody. And if you go there, expect to get sued in court immediately. And, the sheriff's deputies running around town serving papers to everybody. They have like 200 cases in one day filed. And the same's going on at the University of Virginia, by the way, and it's going on in a minority of hospitals. We estimate about a third of U.S. hospitals do this practice. It's a disgrace. But in Carlsbad, I take the doctor at his word when he says he didn't know it's happening. I think people need to let their doctors know when they get an egregious bill. Look, I'm a surgeon. Let me know if you get a crazy bill. We need to be your advocate, and people are afraid of bothering their doctor.
I get that, and I wouldn't want to bother my doctor with my bill, and I appreciate that maybe you'd be willing to fight the good fight, but I have to say one of the other things that really struck me in this book, which, there's so many things here just hit home, but even as you were calling, as a respected surgeon who has this public health degree, you're calling these hospital billing departments trying to help people, and you're getting put through the same ringer where they're making you fax things, or you have to do things by mail, and they won't even give you a break here. What hope is there for the rest of us?
Well, I've listed 20 things you can do if you feel like you've got an unfair bill, both in the book and on this website, restoringmedicine.org, which is our movement to restore the public trust in American hospitals. And people need to understand that those hospitals have board members, and those board members are responsible for the oversight of the leaders of the hospital. And they're often liaisons, they're business leaders. At UVA, we're going to the donors. We went to the doctors, they're on board, they're trying to fight it internally. We went to the executives, they're being difficult and they're not going to stop suing people. So we went to the board members, and now we're going to the donors of the University of Virginia saying, tell them you're not going to donate if they continue to sue people.
And so that might ultimately have the impact?
Yeah, we're trying to create public accountability. There's no one recipe. The first thing people should do is look for mistakes on their bills, Google the codes, see if they had those things done, politely ask, explain hardship, and then take it up the ladder if they feel they've been unfairly billed. And believe it or not, when you get to the right person, they're often very forgiving at the hospital.
Okay. So we talked about this one situation where you've had some trouble trying to get people to actually listen, but you start your book with a real horror story where you were able to have a huge impact and really make a difference. And this scene starts in such an unlikely place. It's a community health fair sponsored by a church. Where did things go wrong from there? Tell us what happened.
Well, this was difficult for me to watch because I grew up going to church. I love going to church. And to see doctors go to the local churches in the African-American areas of Washington, D.C. and Prince George's County, which is the predominantly African-American suburb, offering to do free health screenings putting an ultrasound probe on people's legs looking for plaques when the U.S. Preventive Services Task Force guideline condemns peripheral vascular screening. And they're telling people, looks a little funny, come into our clinic. We'll shoot an x-ray. Oh, guess what? We found a blockage, but we ballooned it open. Come back in a few weeks and we'll put a stent in it. And what this is predatory medicine. And
these people don't need this procedure.
They don't need it. Like if you look for plaques in 75-year-olds, you're going to find them, in 8 out of 10 folks. We don't need to hunt for disease when there's no evidence to support the intervention helps. And so what we have found is this practice that's really predatory. And we started to tell the pastors, hey, this is going on. And just so you know, it violates the guidelines. And this is the deal. 4 of these centers within 2 miles of one spot in Greenbelt are doing these procedures all day, every day, mostly on people who don't need them. And it was the cardiologist that alerted me to this. It was the good doctors saying, hey, you got to do something. Someone has to speak up. And so we've shared the data with Medicare. We've shared it with the Society of Vascular Surgeons. There's a lot of action. The Wall Street Journal obviously did a piece on surgeons sound the alarm on leg procedures. So we're finally creating some accountability, but we need to appeal to the best in people. I don't see the outlier doctors as bad people. I see them as people who need help, and we need to take care of our own. Now, look, I'm sure some of them are doing procedures for money, but also when doctors get burnt out and they feel that they've been wronged by the payers and they perceive that their procedures are safe, sometimes that's a recipe for unnecessary care.
I mean, it just seems terrible to think that they would enlist the churches and have community health fairs for the sole purpose of making profit off of people. That's the kind of thing where, just as a layman, it's hard to think, wow, my physician has my best interest at heart if there's some rogue guy doing something like this. But you still believe that most doctors they're not up to no good.
I try to see the best in people because I remember our first year of medical school. And you look around, people are excited, they're altruistic, they have incredible backgrounds doing child immunization programs in Nicaragua and volunteering. People go into medicine for the right reasons. And so what we need to guard against is this sort of trap of burnout and entitlement in this system that emphasizes billing and throughput. And we need to just reject that. And one of the great privileges in writing the book was to tell the story of these disruptors who are saying, no more billing. This is for the birds. Look at primary care. It's completely broken. We're going to redesign care from scratch and talk about the appropriateness of care.
And when we come back, let's talk about some of those disruptors. We need to take another quick break. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU. Welcome back. We're here with Dr. Marty Makary. He's the author of The Price We Pay, What Broke American Healthcare and How to Fix It. He'll be at St. Louis County Library headquarters tonight at 7 p.m. Dr. Makary, your book isn't just doom and gloom, even though I'm kind of focusing on some of these scandalous aspects of it. You also found a number of people who you're really impressed with who are doing things that are disrupting this broken system. Give us an example of somebody who's just, they're knocking it out of the park on this subject.
Well, you're right, Sarah. In the end, I left very optimistic after all of this research on healthcare, and it's because of these innovators. I mean, take, for example, relationship-based clinics. Specifically, these clinics are called Oak Street, which is an Illinois-based company, ChenMed, Iora, Landmark, and basically they're saying, we are sick of this billing throughput model. We're going to just spend time with people and talk to them. And they are now spending time talking about food as medicine. And teaching people with diabetes cooking classes. And they're treating back pain with ice and physical therapy instead of surgery and opioids many times. And they're addressing one of the great public health problems no one's talking about, and that's loneliness, especially in our seniors. And they're creating communities. And they're in one of the clinics, they literally cleared out the billing room and converted it to a community center where they have classes. And this is the great movement to reclaim medicine.
And how are they making that work on a practical level? These aren't just pie-in-the-sky guys looking for foundation money. They actually have a system that pencils out.
Yeah, they basically get paid on a lump sum basis, and the same exists for people under 65 who are not Medicare eligible. That's called direct primary care. There's both affordable direct primary care and there's concierge, sort of elite primary care. But these Medicare Advantage plans for people over 65 are just telling people, you can come over for free. If you're over 65, Medicare Advantage will pay for everything in a lump sum, because they've made the case now to Medicare Advantage that if you just let us be doctors and take care of people and get rid of all this other nonsense, at the end of the year, you're going to save money, and you're going to save more than 15% is what the numbers are showing.
And so by cutting out these middlemen, they're able to add in all these extra services that they can do for what we don't even think of as high rates. These Medicare prices are sort of the bottom of the industry.
And the culture at these clinics was amazing. You know, they see themselves as a team taking care of a population. So if you feel like you need to go to the hospital, they want to talk to you quick. Maybe they can avoid that hospitalization. If it's just an IV bag that you need for a little rehydration, they'll encourage you to come to their clinic, and they do the right thing, and they spend time with people, and they get at the root causes of illness. And it's amazing. Their hospitalization utilization is much lower. Their ER use is much lower. Their readmission rates are much lower because they're coordinating care and developing great rapport.
So you're talking about people cutting out the middleman, but at the same time, so many other people are stuck in this insurance-based system. We asked some of our listeners for questions in advance of having you on, and David on our the St. Louis Public Radio Station Facebook page wrote, before Obamacare, we had an HMO, and we would just pay a $10 copay, and all other expenses were covered and taken care of by the HMO. But that plan did not meet Affordable Care Act guidelines, so it was canceled. The closest equivalent cost plan available now is essentially a major medical plan. Every time we go to the doctor, we get extraneous and unexpected bills coming. With Obamacare, the U.S. really did sort of double down on the idea of the insurance-based system. Do you feel like that was a mistake?
Well, it's the system we have to work with. And what I try to talk about is what's feasible, what we can change that's feasible. And I would say turn off all the cable news and everything you've heard about, all that stuff. And let's talk about these common sense solutions. By the way, Obamacare intended to do three things. One, create patient protections. And part of that was protecting pre-existing conditions, creating a minimum benefits standard, and getting rid of lifetime caps on insurance, and keeping kids on their parents' plan until they're 23. There was almost 100% bipartisan support for those things. Mm-hmm. So that was good. Let's call it what it is. Okay, the critics, we got to acknowledge that was a major step forward, banning dirty practices in insurance. Second thing it did was expand coverage. It probably only got half the patients it wanted to in terms of the uninsured converting to insurance. We can argue if it did it in a expensive way that was not a great way. That's an argument we can have. But the third goal was that it was going to lower costs, and it did not do that.
Yeah.
And it's not because it drove the price of healthcare up so much for everybody. It's because healthcare costs are spiraling out of control, and it failed to contain them as promised. So that doesn't mean getting rid of it is going to fix the cost crisis. We need these new ideas. We need to address pricing failures, middlemen, and inappropriate care.
Now, the Affordable Care Act, that's Obamacare, I learned in your book, it requires hospitals to have financial assistance policies, and they're not allowed to charge patients who qualify more than they would charge a patient with typical insurance. Yet I got the sense from your book that wasn't happening. How are hospitals getting around this thing that seems like it's enshrined in federal law?
Well, it only applies to people who are below 200% of the federal poverty line. So there are some good protections out there, and some people are benefiting, but this is a Band-Aid on a larger problem. And as long as, a back surgery costs $650,000, like we saw last week on CBS, none of this stuff is really going to address that for most Americans.
Now, in terms of talking about these middlemen, you're also sharply critical of pharmacy benefits managers, and that includes one of our major local employers, which is Express Scripts. They're kind of thought of as a good guy. What do you see as the problem with these companies?
Well, they came along to sell their services to businesses, to tell the business, hey, we're going to save you money on what your employers spend on pharmacy because we get bulk discounting and we have leverage and we know how to steer patients to certain better medications. The problem is they got bought by both insurance and pharmacies. And so their fiduciary role disappeared. And now they make money from selling drugs as opposed to cutting your pharmacy spend. So now you've got mail order games. Now, mail order is great for a transplant recipient that needs those medications. It's not good for your person on Zantac, which, by the way, just got pulled off the shelf at CVS. It's not good for these medications that people don't necessarily need to take every day, but they're just being automatically shipped to people's homes because it's an automatic sale. These are the money games. People have stockpiles of medications they've never had before. PBMs, or these pharmacy benefit managers, don't even exist in other countries. Well, they didn't exist in the U.S. before 20, 30 years ago. They are this middleman that's not intrinsically good or bad. It's just they've lost that fiduciary role. And businesses often ask me, I know I'm getting ripped off on my pharmacy plan. How do I fix it? And I send them to independent brokers and agents who don't take kickbacks from the PBMs, because most do. And they take these commissions and kickbacks, and get an independent broker, and they will guide you to a PBM contract that's better, even with the same company. So it's not that one PBM company is good or evil. It's that you can get a much better deal if you know how to sift through the rebates. Rebates are not really rebates. This is not a rebate on cornflakes. This is a kickback from pharma to the PBM, a middleman kickback, of which a portion is shared with the patient or employer. That's why they call it a rebate. It's not a rebate, it's a kickback.
You also dedicate an entire chapter to the air ambulance industry, and that has been in the news here quite a bit. The St. Louis Post-Dispatch did a whole series on the problem, and it wrote, those representing the insurance industry say the flaw in the system is that there is no incentive for air ambulance companies to join a network. This is what happens when an insurance provider is not able to negotiate those lower prices for you. You as a consumer are left to see the entire impact of the out-of-control prices, a spokeswoman for America's Health Insurance Plans said. Would you agree with that as being the root of the problem with these air ambulance, that they're outside this insurance industry?
Well, they took themselves out of the networks. They came along to hospitals and said, hey, we'll take ourselves off the master bill and we'll charge the patient directly. You don't have to worry about this stuff. And they started gouging. And it's not just air ambulances, it's ground ambulances.
Some huge prices you catalog in your book.
I mean, there's an air ambulance bill that's like the price of the aircraft. I mean, you could go to China and back 6 times for the price that they're charging you for a 30-minute flight across Missouri. I mean, there's a lot of price gouging going on there.
And yet this was kind of one of those parts of the book where you were able to find the silver lining. You talked to some people who are providing alternatives. Tell us a little bit about the physicians who've decided to get into this business.
Well, some emergency medicine doctors are taking back their air helicopter, air ambulance programs. They're running it really well. The billing is fair. It's part of the insurance bill, so it's a part of the network discount that you get with your insurance company. And a company named Sentinel Air in Montana was so fed up with all of the gouging that they decided to open up their own, essentially, communications center or brokerage group where they will find you an air ambulance close to you that will give you a fair price for a ride. And it will always be less than $20,000 no matter where, from point A to point B in the continental United States. You can go from Alaska to Naples, Florida, and it will never exceed that amount. They have reasonable pricing, not $200,000.
That sounds like the best sort of disruption.
It is. It's funny. They said something like, I don't remember the exact words, like people are getting ripped off. The air ambulance company, the big giant, which is a Wall Street company, sued them for defamation. And they decided to fight it in court, and it's at the final 1-yard line. I think they're going to win.
Boy, that'll be nice. Like, way to see the bad guys lose on that.
Yeah, I mean, just to show you, people think we live in a free country. All they did was said people are getting ripped off on their air ambulance, and they got sued for defamation by the big air ambulance company.
That's amazing. I mean, if we needed more proof that these guys are up to no good.
Yeah.
So this is actually your second book that calls out the medical establishment. What was it that you were focused on in the first?
It was the quality disparities. When people are told, come to our breast cancer center, and it's really just one doctor, I felt like there needed to be some honesty. Look, most doctors do the right thing and always try to, and we don't want to create hysteria. But this book alerted people that you may want to get a second opinion when it's something major. 20% of all medical care is unnecessary, according to a national survey we did of doctors, of 2,100 randomly selected doctors. They said 21% of all medical care is unnecessary. When you have an industry saying that 1 in 5 of their services is unnecessary, that's a warning. That's an alarm. And so the book was turned into the TV show The Resident on Fox, now in its 3rd season.
What kind of reaction did you get to the fact that you were calling out your own industry?
Well, initially I think hospitals were defensive about it. Some doctors were territorial, but everything came true. I talked about readmission rates and infection rates as something that should be public information. A few years later, that's exactly what happened.
So you were able to have a huge impact.
Well, I won't take all the credit, but I will tell you that all the naysayers that said this is impossible and it will drive up the price of healthcare, they were all wrong. When we did our study that medical care gone wrong, if it were a disease, would be the 3rd leading cause of death. All these folks said, no, that's impossible, it's wrong. Next year, the opioid epidemic becomes the number 1 cause of death among people under 50 in the U.S.
And that's something that really was driven, as you say, by overprescription by physicians.
Exactly.
So people came around to your point of view on this.
Yeah, so when people say, we can't give you prices at hospitals, we just can't do it, you know, I've heard these naysayers before, and we need to look at things from the patient's perspective.
We talked earlier this week to Dr. Art Gale. He's a retired physician here in St. Louis. He's heavily involved with the medical arts series that you're speaking at tonight at St. Louis County Library headquarters. And like me, he had just recently finished your book. And like me also, he came across really impressed. Here's what he had to say about it.
It's an outstanding book, and he deserves a tremendous amount of credit because Dr. Makary has integrity, strong ethical principles, and he has had a sense of outrage at what is going on in healthcare today. And you see, he didn't need to do this because he has a great reputation as a surgical oncologist, gastrointestinal oncologist. He operates on such conditions as cancer of the pancreas. And he has also been very active on reducing error in surgery and was a major force in developing the surgical checklist for the World Health Organization. Also, I would like to say he writes in easily understood language that the average reader can understand and appreciate.
And that's Dr. Art Gale, a retired physician here in St. Louis, praising The Price We Pay, which is the new book by our guest, Dr. Marty Makary. So as Dr. Gale references, your biggest claim to fame might well be this surgery checklist that was later adopted by the World Health Organization. What was the origin of that?
Well, it just seemed crazy that we were not able to standardize certain procedures, certain things that we need to do before surgery, like giving antibiotics before the operation, and checking on certain aspects of the safety of the procedure. I would hear from nurses that they've worked with a doctor for 10 years and the doctor still doesn't know their name. And so
that's crazy.
You know, you realize, but you know, in universities, we often move around so much. We've got masks covering us in the operating room. So I just thought this is a great opportunity both to standardize certain procedures that we need to do before surgery, just like pilots do, and also we need to create civility. A great workplace culture is based on knowing each other's names and knowing who's on the ship. And I tell my trainees, the surgical residents, when you call for something by name, Chris, I need a chest tube, 32 French, you're far more effective than if you just yell for the thing you need. And so creating civility goes a long way in improving safety, and it creates a culture of speaking up where people feel comfortable voicing their concerns at any level, students, nurses, techs. And that's what we need in medicine. So it's cool to see the surgery checklist blossom and mature. And of course, Atul Gawande helped really promote it with his book after I shared it with him at the WHO. But those are very nice comments by Dr.
Gale. Yeah. You're also giving a presentation to the Signature Healthcare Foundation while you're in St. Louis, and that includes a lot of business and industry leaders. And Dr. Art Gale told us earlier this week that he thinks the fact that you're communicating to business leaders is really important. Here's what he said.
The reason he speaks to them is because it's not only the medical healthcare consumer, but it's the business owner. Sometimes his biggest cost is healthcare, and some people have shifted their production to other countries because of the high cost of healthcare for the employees in the United States.
So that's Dr. Art Gale. What do you think it's going to take to get business leaders on board for some of the solutions you're discussing here?
Well, they're starting to move. I mean, you just saw Walmart announce their health centers, and same thing with some other businesses. They are moving the field. They are creating the demand for honest pricing and honest quality in regions, and they can do that because they're paying. They're self-funded now. So exciting stuff is happening. And, I have colleagues that say, Marty, what are you doing? We're all pancreas cancer surgeons, we're surgical oncologists. And I tell my partners, and we're all friends, but I say, we can have the cure for cancer, but if half the public doesn't trust us, those cures are no good. And right now we have a serious trust problem going on. When the polio vaccine was invented, the inventor, Dr. Salk, said, I will never get a patent on this, despite everybody urging him to make money by filing a patent. Forbes says that patent would have been worth $8 billion in 1954 dollars. Dr. Salk, knowing that 20,000 Americans were in an iron lung machine in what's probably one of the most horrible things we could ever envision, he said, this will be the property of mankind. This polio vaccine will be a gift to humanity. That is our great medical heritage. And that's what I'm appealing to in people, because doctors are eager to see our great public trust restored and these money games cut out so they can be doctors and take care of patients without all of these games.
And at the same time, though, there are so many people who have a vested interest in keeping this current system because they're making money off of it or because their company depends on it. Is this something, it just seems like it's going to be hard for physicians to be able to achieve this on their own. Do you think there's something the federal government could be doing at this point that would be meaningful towards these reforms you're talking about?
I think so. And I mean, look, I'm not relying on the government, but you better believe I'm in those offices all the time with senators and members of Congress. I'm in the White House frequently. I talk to leaders at HHS and CMS. It's not what it looks like from the outside. What we're up against is not a right versus left fight. What we are up against are the special interests versus the American people. And I think people need to voice their concerns. I mean, we need to get rid of secrecy in healthcare, and we need to get rid of kickbacks in healthcare. That's the basic platform I take to all politicians.
Do you feel like any of the people who are currently running for president are speaking to these issues or have sort of taken this on in a way that you feel like they know what they're talking about?
Not really. I mean, if you look at the pile on insurance during the debates, where's the discussion of hospital prices? Where's the discussion of the fact that our standard medical service in the United States costs 4 or 5 times that of other countries? Nobody touched that stuff, and it's because of, I believe, dark money and special interest money. I was disappointed to see all of the doctors' associations oppose every form of surprise bill legislation on the Hill right now. And
this is a bill that's pending that you feel like would help with some of this?
There's 3 great bills. The Murray-Alexander bill was one I was involved with. It's a bipartisan bill. These are great bills that move us forward. They're not perfect. And every doctors group came out against it, not because the doctors are against it, but because the trade association bulldogs at the top who play games of threats and campaign contributions are protecting the interests of the small fraction of doctors out there that are price gouging and profiting from this. So we see the same with the other big stakeholders in Washington, D.C.
So physicians' own trade associations are fighting what you see as the good reforms here. What's it going to take to get physicians to sort of take that on and say, this is not the voice we want for us?
I think it's mass healthcare literacy. We as doctors are taught medical literacy. We're never taught healthcare literacy. And the story of the business of medicine can be taught, I believe, in a way that's relatable with stories, and that's what I try to do in this book. Just like The Big Short created literacy around the financial sector, that's what we need around healthcare, and I believe you will see broad consensus in the United States.
So what advice would you have for somebody who's listening to this show and they feel like, yeah, I'm on board for this? What can they do to help move the conversation in the right direction or to get our politicians moving in the right direction? There's
a lot. First of all, call your member of Congress and your senator and talk to them about the surprise bill legislation and how important it is and how that's an important thing for you as a voter. Go visit with them. Talk to your state legislature. Some of them now are moving some surprise bill legislation that get at price transparency. No one's saying we should give you a price when you're shot in the chest. Okay, we doctors should never do that. We need to take care of you. but 60% of care is shoppable. And even though everybody will not use pricing information, especially when they're not paying, some will, and they will keep markets in check for all of us.
Dr. Marty Makary, thank you so much for joining us today.
Great to be with you, Sarah.
And Dr. Makary's book is The Price We Pay, What Broke American Healthcare and How to Fix It. He'll be at the St. Louis County Library headquarters tonight if you want to join him. St. Louis on the Air is a production of St. Louis Public Radio 90.7 KWMU. Thank you for listening. I'm Sarah Fenske.
Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.